Hello, today we're going to go over a quick overview of the neurodevelopmental disorders associated with DMD. When discussing Duchenne muscular dystrophy, or DMD, the first thing that comes to mind is the deterioration of muscle function and the consequential loss of mobility. DMD is commonly described as a X-linked degenerative muscular disease, hallmarked by a mutation in the dystrophin gene that leads to the breakdown of the membrane of muscle cells. The inability to properly contract muscle over time leads to a cascade of comorbidities such as fibrosis, inflammation, loss of ambulation, and eventually cardiac and respiratory failure. As with other chronic and progressive disorders, DMD patients face a two-front war, an attack on their physical and cognitive abilities. The mental well-being of DMD patients is just one part of a complicated web of multidisciplinary care and assistance that DMD patients need to improve their quality of life. According to a breakdown in Colvin et al.'s article on psychosocial treatment of DMD patients, approximately 32% of patients had attention deficit hyperactivity disorder, ADHD, 26% had learning difficulties, about 22% had an intellectual disability, 27% had anxiety, and 15% had autism spectrum disorder. This suggests that young boys with DMD are almost twice as likely to experience some type of mental disorder than similarly aged healthy boys. In a specific study focusing on attention deficit hyperactivity disorder and cognitive function in Duchenne muscular dystrophy boys, they found deletions of exon 45 to 55 in the dystrophin gene were associated with increased prevalence of ADHD. The findings of the study implies a phenotype-genotype correlation between the loss of dystrophin function and behavioral or cognitive disturbances. A downturn in mental health status is closely related to furthering DMD disease progression, as found in a study completed to assess the psychological aspects of youth with DMD. In this study, when tasked with drawing themselves and their family, themes of depression, isolation, rescue, or disaster were highlighted. When children with DMD begin to realize that they're different from other kids their age, at around 7 years old, depression begins to take root. In comparison to their peers, boys with DMD are limited in their ability to physically express themselves, which can cause outbursts of depression, frustration, and later aggression. So, how do we care for this aspect of DMD? As with the physical symptoms of DMD, early diagnosis or recognition of the symptoms of deteriorating mental health in these boys can drastically improve outcomes. The first step would be regular and frequent mental health screenings during hospital visits and close daily supervision or observation of caretakers or parents. The severity of DMD on an individual's development has psychosocial consequences that require community and familial support from an early age. Formal neuropsychological assessments take into account the developmental age and stage of the patient while evaluating academic skills, social functioning, emotional adjustment, and cognitive function. For instance, for learning or intellectual disabilities, the patient might require specialized academic support acquired through assistance from educators and schools. ADHD and anxiety interventions most commonly consist of medication prescriptions and psychotherapy. Social skill training resources, behavioral therapy, and academic support is recommended for boys with DMD and neurodevelopmental disorders. Then interventions can later be tailored by social workers, therapists, and educators to best assist the patient. In order to improve quality of life for DMD patients and help them properly cope with their diagnosis, they need mental health care in addition to the treatments they receive for physical ailments. Just as maintaining muscle strength and mobility requires a well-developed team of experts and professionals, adequate resources must be available to holistically support DMD patients and their families. Higher risk and prevalence of neurodevelopmental disorders among DMD patients, these treatments and resources are necessary to ensure these boys have equal opportunity to learn and have meaningful social connections. Thank you.